guys, welcome to another response physiotherapy workshop. Today we're going to be talking about running and the mechanics involved in running. Now, running itself is a single leg based activity. There are two phases within your running. You have your contact phase where your foot is taking its initial contact within the ground. You then have your non-contact phase or your swing phase where your leg is off the ground, propelling itself forward to take the next step.
So next we'll talk about the difference between sprinting and long distance running. In sprinting you require a much higher force over a shorter period of time, with more hip movement and a longer swing phase. In long distance running you have less hip movement and more movement around your knee and ankle, which requires more contact phase and a slightly different type of muscle fibre used. These two different types of running techniques mean you're more susceptible to certain injuries, which we'll talk about next.
Now, with any type of activity, whether you're a sprinter or a long distance runner, you're going to be more susceptible to different types of injuries. Now, with a sprinter, the hamstring muscle group is a big muscle group that is contributing towards a lot of hamstring strains. This can be a very, very sudden onset of pain in the back of the hamstrings, which typically can be related to either fatigue, muscle weakness, or lack of endurance within these muscle groups.
So in long distance running, you're more susceptible to gradual onset pain. This tends to be due to the mechanics of your running, any muscle imbalances or any changes within your intensity or level of training. So as we run, if we have muscle imbalances or muscle weaknesses, what tends to happen is we will pronate into our foot, we'll go into more of a knee valgus position and internally rotate our hip. This puts more pressure into different areas around the lower limb, especially onto your knee and ankle. This can cause you different issues, for example, anterior knee pain, Achilles tendinopathy, or plantar fasciitis, to name a few.
One of the things to take in consideration when we're training is FDI, your frequency, your duration, or your intensity. Usually when injury happens, one of these three things can always be attributed to the injury. Either you have trained too many times, you have trained too long, or you have trained far too hard. By using this as a format can help plan your training sessions, particularly with long distance running or sprinting, to actually help reduce injuries.
So next we'll look at a couple of different exercises to help improve strength, stability, balance and good running mechanics.
A good exercise to help reduce risk of injuries to the hamstring is an isometric hamstring hold. Now Jeremy's going to demonstrate this exercise for me. You want to make sure that you have a slightly elevated step. His foot's going to be going on top of that step and ensuring that his heel is in contact and not putting his foot flat. He's going to lift his opposite knee up towards himself, and then he's going to lift his bottom up off the floor and making sure that he can hold that position and really firing up those hamstrings. It's really important to replicate the mechanics of running by ensuring that the opposite knee is driving up towards his body, holding that position and replicating that motion and that mechanics of sprinting.
So the next exercise we'll be demonstrating is called a single leg RDL driver. So what Alex is going to do is he's going to stand on one leg, he's going to lean forward and hinge with his hip, and then he's going to drive through with his opposite knee and opposite arm. Keeping the arch support nice and reducing the balance in the knee, this helps to adequately load the hamstrings and the muscles around the hip to try and improve running mechanics. This helps to reduce running risk of injuries. So there we talked about the differences between sprinting and long distance running, the injuries associated with the two, and went through a couple of different exercises to help you improve your strength, balance and general running mechanics, all aimed at helping to reduce the risk of injury when you're running.
To further reduce risk of injury, I would take into consideration FDI into your training schedule or routine. If you're having a current issue with your running technique or your training schedule and needs further investigating or assessment, you can come and see either myself or Jamie at the Nottingham-based clinic. Equally speaking, you can always call to book in at one of our other physiotherapy clinics around the country. Until then, we do look forward to seeing you again for another workshop video. See you later.